BR Group 4, presenting pathophysiology case presentation on our lung cancer patient for MSN 570, United States University. Our group include Mary Celeste, Zachary Shell, Kemi Sani, Melika Valentin, and Daisy Shelton. That is lung cancer. Lung cancer starts in the lungs as a growth of abnormal cells and often metastasizes, spreading to other organs in the body. It is the leading cause of cancer-related deaths. Here are the main risk factors, types, detection methods, and treatments. Main environmental external risk factors are exposure to tobacco smoke, asbestos, radon, or other air pollution. Our patient is Robert L. is a 66-year-old retired electrician from Pendleton, Oregon. His medical history is notable for hypertension, uncontrolled, hyperuricemia, and gout. In July of 2019, he presents to his primary care physician with fatigue, progressive dyspnea when walking, lightheadedness, coarse voice, and a persistent unproductive cough of 4 months duration. He is a former smoker and quit nearly 30 years ago. He has had unintended 15-pound weight loss over a 3-month period. Factor and lung cancer. Cigarette smoking is the number one risk factor for lung cancer. In the United States, cigarette smoking is linked to about 80% to 90% of lung cancer deaths. Using other tobacco products such as cigars or pipes also increase the risk for lung cancer. Smoke from other people's cigarettes, pipes, or cigars, secondhand smoke, also cause lung cancer. When a person breathes in secondhand smoke, it is like he or she is smoking. Lung cancer is also linked to workplaces that increase risk include asbestos, arsenic, diesel, exhaust, and some other forms of silica and chromium. For many of these substances, the risk of getting lung cancer is even higher for those who smoke. Radon is a naturally occurring gas that comes from rocks and dirt and can get trapped in houses and buildings. It cannot be seen, tasted, or smelled. According to the U.S. Environmental Protection Agency, external cancer survivors who had radiation therapy to the chest are at higher risk for lung cancer. Also, arsenic in drinking water, primarily from private wells, can increase the risk of lung cancer. For more information, visit the EPA Arsenic in Drinking Water. Scientists are studying many different foods and dietary supplements to see whether they change the risk of getting lung cancer. There is much we still need to know. We do not know that smokers who take beta carotene supplements have increased risk of lung cancer. The signs and symptoms of lung cancer may include a cough for 3 weeks or more, a change in cough you have had for a long time, a chest infection that does not get better, or getting repeated chest infections, feeling breathless and wheezy for no reason, coughing of blood, chest or shoulder pain that does not get better, a hoarse voice for 3 weeks or more. Other possible symptoms are losing weight for no obvious reason and feeling tired.
Slide 6, diagnostic studies Our patient, Robert L., has presented to his primary care with signs and symptoms that warrant further investigation and the utilization of diagnostic studies to rule out lung cancer. There are imagery, there's sputum cytology, tissue sampling, and staging, all part of the process. Imagery, the best one to be utilized, that most accurate, is the CT. Sputum cytology is revealing lung cancer cells. Tissue sampling, there's many ways to do that. There's needle biopsies, there's bronchoscopes, thoracoscopes, mediastinum scope, and all which kind of each can remove tissues, also examine. Some can be done, resectioning can be done, removal of nodes and lesions can be done, and it can also help with staging. The staging is done usually through the TNM staging system that you can see here on this slide. It's 1 through 4 stages, and then your treatment is put together according to the stage. Biomarker blood tests are done. There's plasma tests that are done along with the biopsies to kind of determine the best options for treatment. Let's talk about non-small cell and small cell lung cancer, and depending on the type, where it usually presents and how it presents. So the non-small cell lung cancer usually presents in the central zone of the lungs, peripheral organs, and the alveolar surface, the epithelium or bronchial mucosa. As where the small cell, which is more invasive, is typically appears or presents in the central lesions with hilar and mediastinal invasion. Also common distant metastasis to the bones, liver, adrenal glands, and pericardial are just a few. Some of the pathological processes for Robert's current signs and symptoms: weight loss, fatigue, dyspnea, voice changes, and cough. Let's see why that might be happening. The weight loss could be a loss of appetite, along with the fatigue and some nausea. There are changes that are going on with cancer in the body, and some of this cancer releases proteins like cytokines, creating a toxic environment. There's an increased need for energy. You have changes in the organs, the disease is breaking them down, alterations in hormone production. So lots of things there to contribute to that weight loss and fatigue. The dyspnea and cough, when there's some kind of an invasion into the alveoli that can interfere with the oxygenation exchange. The cough, cancer can be irritating to the lungs and to the bronchi, stimulating the nerve and the need to cough. So you have that constant, not verbal cough. There's lightheadedness. That can also be caused from the lack of oxygen and fatigue. Hopefully, Robert's prognosis isn't going to be either one of these.
This is Melly Carvalentone with Group 4, discussing on the continuation of pathophysiologic process for our patient, Mr. Robert L. Lung cancer process begins with an abnormal cell growth out of proportion in the lung or the lungs. It can affect any healthy tissues and form tumors. It can affect any part of the lung or the lungs and can spread at any time to any part of the body, or what is called as metastasized. Robert L., although he quit smoking about 30 years ago, had exposure through smoking which created shifts in his genetic makeup, shown in Figure A, as small red circles affecting the epithelial lining of his respiratory tract. This is called the airway field of injury. In Figure B, which is the adjacent field of cancerization, it depicts the normal airways in gray shade next to the lung tumors, marked as small red circles. Figure B showed that close proximity to the cancer tumors are greatly affected. Figure C shows the progression of lung cancer, starting with a normal epithelium, then with smoking as a trigger creates a molecular alteration, causing a field of injury on the epithelial cells. In a study by Kadara, Sheikh, Westubel, and Spira in 2016, they indicated that there is still no clear evidence as to the progression of the molecular airway field of injury to pre-neoplasia in lung malignancy. End of quote. The 2000 study from Kadara et al. Implied that lung cancer detection and chemoprevention is achievable through pinpointing early markers causing changes in the field of injury. Treatments and outcomes include surgery, which includes surgical operation to cut out cancer cells. In the illustration, there could be wedge resection, lobectomy, or pneumonectomy. Chemotherapy is used as a way to shrink or kill cancer cells. In the illustration, chemotherapy alone or combined with radiation may be used before, after, or instead of surgery in treating cancer cells. And there can be use of radiation, which is using high energy rays to kill cancer cells. Another method is called targeted therapy, which is using drugs to block growth. Thank you. This is Melly Carvalanton for Group 4.
Including alternative therapies into Robert's care plan can also be extremely useful, as these alternative therapies can be used to control pain, reduce anxiety, and lessen the side effects of the treatment, and also improve his quality of your life. There are many different types of what they call CAMs, which are listed below, such as mind and body medicines with the use of meditation and biofeedback can also help reduce stress. Biology-based practices such as vitamins, herbs, and special diets also help lessen some of the side effects. Touch-based practices such as massage, energy work, therapeutic touch, and whole medicine systems, along with Chinese medicine. A lot of these treatments can be used along Robert's treatment to, like I said, lessen the effects of the treatments themselves and also some of the effects he can be having from the lung cancer. With these types of therapies, though, you need to use caution, as not all of these are backed by science. Some can even harm Robert, so these are things that we need to take in consideration during his treatment and care. In summary, Robert lived a long and happy life and had a full recovery from his lung cancer. Some important points to remember, though. Lung cancer is the most common cancer in the world and is the leading cause of cancer death in men and women in the United States. And cigarette smoking is the number one risk factor. Lung cancer starts in the lungs as a growth of abnormal cells and often can metastasize to many parts of the body. Symptoms include weight loss, a cough that doesn't go away, shortness of breath, fatigue, and also a hoarse voice. Diagnostic studies such as a chest x-ray, bronchoscope, fine needle aspiration, or even a CT-guided, CAT scan and PET scan, and pathology can diagnose this. Early treatment is key, as lung cells have a rapid rate of metastasizing with this type of cancer. Surgical treatments include actually cutting out the cancer cells, or chemotherapy to shrink or kill, radiation to change the growth and stop the cancer, and targeted therapy uses drugs to block the cellular reproduction. Many people use complementary and alternative therapies alongside treatment, as it can lessen the effects of the treatment itself and also lessen the effects of cancer. Thank you for listening to our presentation.